Thank you so much for the introduction, and thank you so much for the opportunity to talk here. I hope you still have patience and a little bit of space in your tummy to wait for this little idea. This is a very honorable position for me to be here, and I first of all want to thank everyone who made this project possible to be presented, because we actually submitted it very shorthand. It's an idea, it's a brainstorming, it's not a ready project as Cleopas beautifully presented. This is hopefully our future. But so many people who are listed here very spontaneously agreed to maybe collaborate in this and discuss this together, and I hope more are going to discuss this. And I already during the conference found some very motivated people to think to discuss this with us, and maybe we can agree on going further, which includes Gita, Angelo, Arabella also, and Alexandra. So thank you for everyone who's discussed so far. And quickly, a few fundings I want to thank now. And to go back on the background, so why am I standing here? I'm not a specialist on digital health. I'm not a senior person. I'm a very junior clinician. I'm in neurology training. And, but I've had my experiences with a lot of patients already, and also I've had my own experiences, because maybe, as you know, I'm also from a patient family. So the patient journey doesn't only affect what I hear from patients and what I've heard in other conversations, but also I've found it to be true. So what we did in Charité in the back in the past was thinking, okay, can we find a solution to maybe look at the problems that are from different perspectives, because there's not only us as clinicians who say, well, we need more patients to understand to better the natural history, for example. Industry needs more patients for the trials. Researchers need patients to donate samples, and patients want care. And we decided to first focus on what does the patient want and how can we work together in solving what our ultimate goal basically is, what the patient needs. And so we conducted a very small pilot study on patients in Germany, and we designed a little questionnaire quantifying the patient journey, asking them how they've been, how long they've taken to get a diagnosis. We designed this together with the German patient advocacy groups, and we distributed it as a red cap survey via the registry patients in Charité, and also the patient network and the patient representative group in the DGM, and then looked at actually a quite astonishing number of patients who answered, because it's a quite small group we sent it to, but lots of patients were motivated to give us answers. And so some of the findings here, and I think the most striking one is the very, very long duration of patients looking for a diagnosis, which had a very, very big span. Some patients were diagnosed before even they reported to have symptoms, because maybe of positive family history, and patients sometimes were diagnosed only after 60 years, like 60, which is almost a lifetime. And the nice thing is that this improved with younger patients. They're diagnosed earlier, so we're doing a good job. It's becoming better, but it's still a big problem, and we still see a lot of young patients who really have odysseys to find their diagnoses. And we looked a little bit of what happens. So who do patients turn to first when they look for help? And lots of people go to neurologists, which is actually quite nice, but also lots of people go to their GPs, pediatricians, and of course orthopedic specialists, because they might turn up with their sprained ankles or foot deformities. And we also saw that when people first go to orthopedic specialists, they take longer to find a diagnosis, which might be a lack in our country of orthopedic surgeons knowing that this is caused by CMT, which is maybe a first target to improve this. And also we asked patients how invasive, how painful the procedures were until they were diagnosed, because basically for hopefully most of us it's only a genetic test which is drawing blood and it's done, right? If you think about the diagnosis. But lots of people did receive a lot more painful in hospital lumbar punctures, lots of neurographies and EMGs, and all of kinds of examinations before genetics were performed. Looking at those that have a genetic diagnosis, that could be easier. And also we looked at misdiagnosis, which I personally experienced quite sometimes, that people come with CIDP and then I think, I don't know, maybe it's CMT, and that is. And we saw we didn't ask patients which kind of misdiagnosis, and of course this is all patient reported, so maybe people are also very unhappy, so they report it's been misdiagnosed a lot of times. But this showed that more than half have been misdiagnosed before they received the CMT diagnosis, which is very sad because it's really only a genetic test for most, hopefully. And also a third of those got a wrong therapy, they reported. So maybe IVIG because of CIDP misdiagnosis, and were hospitalized for other diagnoses they had before, or they had also, some of them also report that they have a bad influence on their current health state. So we asked them in the beginning, how do you feel now? And people who had a misdiagnosis before felt bad or worse now, which also obviously can correlate because they're more unhappy. But maybe it's also something telling us about how their journeys are, really impacts on how they feel now. Then we also asked, so what's important for patients? Where do they go when they have questions? And I was really surprised that not a lot of people said they go to the internet. I thought a lot more people would say that. Maybe they didn't do it because they knew some clinicians were going to look at that. But lots of people really want to see specialists in the disease. And they also, the only people who really said they have a very, very bad healthcare state at the moment are the ones that are not connected to a CMT clinic, or they don't have any connection to a specialist. So it's very important to them to know someone who knows about the disease. And I think the most impactful things are always the quotes that people give. And these really reflect a little bit of these problems. People felt lost. They wanted someone to guide them on their journey, want specialists to know, especially also specialist physiotherapists and other therapists to know about how to actually help them, and not to oversee things, obviously. And yeah, so this is a very basic first approach from our side, but of course it only reflects a very small portion of people. And we still thought about what kind of approaches can we do to solve these problems, and also if we do approaches, are these wanted? So again, focusing on the patient, maybe we can even look at approaches that solve problems for more than only the patients. We asked the patients whether they would be able or willing to use solutions that are digital, or maybe have them ask them questions all the time how they feel, because that's bothersome, right? I mean, no one wants to be bothered by the phone all the time to answer some questions about how you're feeling. But people were pretty eager, and this is also interesting because it didn't differ between the ages. Older people above 60 years also were really open to saying, okay, I would use an app to, if I could get information, or if I could ask questions, or maybe also give answers. And during the last patient summit in Germany this summer, we also asked a little bit of what's the most important, if we provide a digital solution for these problems, what kind of features would they most want? And I think the most important thing is that most people really wanted to engage in research and receive, be connected to research and be able to contribute to research. And this is something I think that really goes well hand in hand with what we're doing here, because everyone's looking for patients who maybe donate samples or participate in trials, and that's also what patients wanted. And they also wanted to be informed. They want to know what's coming out of the studies they participate in, and they want to find specialists. And I think all these things are things we can solve together as a community. So just proposing some quick solutions. As ideas, all of this is open to discussion. Nothing's set yet, so it's just ideas. Late diagnosis, before the diagnosis. Well, if we think of genetic testing, we can solve those that are genetically diagnosable, let's see. For the easy ones, which are the majority, I mean, even only looking at PMT21, it's 50%, and we can solve them easy. In Germany, we have the problem we don't find lots of them because we don't think about the disease. So raise awareness is a good thing. And also maybe finding risks to educate or help in clinician support to help people who are not specialized to think of this. What about the undiagnosed, genetically undiagnosed or VOSs? That's more difficult. And I think one opportunity, for example, is getting together in these specialist meetings and discuss these cases more, maybe provide some junior or lower threshold portals, use these expert panels to solve and also to train what to look for. For example, I'm thinking about the great talks we've heard so far. There's so many things we learn, and we can also solve these together maybe. And I think also, apart from what we've talked about, looking at specific subtype registries, maybe we can also have like unsolved patients specifically collected. As also there's genetic platforms that collect these. I think that's very important. And also looking at clinical data, I think that would be great to collect the unsolved patients as a possibility. But looking more into at the patient, like a patient-faced solution for their problems, which is hard, I think, before they're diagnosed. It's really hard to get the patient involved because they don't know what is happening yet. But we could really work together in having the information they want and being presented more widely. And I know that there is a lot of beautiful work done, especially by the patient organizations, patient advocacy groups across Europe, but they really differ between the countries, and I think especially Eastern Europe and also in Germany, there's not a lot of content, so maybe we can benefit from work others have done and just translate it and make it available more easily for patients and make it understandable. The basic information they want, which is basically, what can I do in my daily life? And what does this mean, maybe, to my family? Another thing is the specialist network, and the same here. I think lots of patient advocacy groups have done a great job. For example, in Italy, there's this beautiful map where you can find the centers and the orthopedic surgeons and the therapists. We used to have a bit like this too, but we have to keep it up to date. And I think the important thing here is to also find specialists for things, or for specialties beyond neurology, looking at orthopedic surgeons and therapists, psychotherapists, all these other fields, social workers that are specialized in the field that can help us. Because I don't really have a good network. I'm trying to build it, but I think lots of patients are educated, they're young, they can go abroad and get help. And we can work together to make it grow. I think that would be great, to just provide this kind of map and provide it for all. And yes, also including case conferences, of course. And then I think a big thing for us here is the research trial access. And as patients say that all they want is contribute, and often they also come to me and say, hey, I heard about this other guy who's doing research on CMT4C, why don't you send him my samples? And I think that's so great, because why didn't I know about this? The patients have the time, they have the resources, and if we provide this network to them, they will come to us, and we want to contribute, right? So if we just, it's very easy to do, maybe just provide a map of everyone who does a research and which kind of subtypes, do a search engine and say, okay, I have CMT4C, I want to help, where can I go? For the patients. Maybe this already exists, I'm very happy to hear and use it, but if not, we could maybe make it happen. And also, maybe we can provide patients with the possibilities to even participate in trials remotely by giving patient-reported outcomes or new technologies, and then feedback also results to patients via a platform like this. Why is this interesting also? Because it invites industry to be participating in this, because this is the same, they have the same interest, right? We want to have patients participating in trials and make trials cheaper. This might be an option. And I just want to spoiler quickly, how do you start this video? This. A little talk that you'll hear tomorrow at 9 in the morning about new technologies that might help us, also doing remote trial participations. One thing about when we think about developing new digital solution, I think, is not to duplicate what's already there. And I'm very open, very happy to hear what else there is. And these are some things I heard during the conference, and I know about that exist, that I think we have to use in order to develop this, which is, of course, the patient advocacy groups and the amazing work they do. And the EuroNMD also joined in, I think, with this great work packages. I think all of this can work together really, really well. And just one thing I want to present to you quickly, because I think the idea is so genius, and maybe we can participate or work together or have them expand this, is the project Find Me to Care, which is done in Germany. Right now it's only one commercial lab who does it, but hopefully it expands. And it works like people who are genetically diagnosed immediately receive a QR code, and this way immediately featured into a information network, and they can be findable by studies and other trials maybe who are looking for people who are genetically diagnosed with this. And if this becomes a widely implemented tool in genetic labs, I think we have all of these patients entering the patient journey, and we get to guide them a lot better, because otherwise lots of people get their genetic result by any geneticist and go home and say, what do I do now? And if they're lucky, they find patient advocacy groups. But in my experiences, often they don't. So I think it's a great project. Maybe we can do something like that in the European scale. Yes, also other peoples are doing these kind of things in other diseases, as we've heard in ERN, and I know Arabella is coordinating or helping to do this for CMT, so I would call for her also in a collaboration for the project, maybe looking for patients and clinicians representing from different countries, different points of views, so we can also make this more public on these kind of patient journeys, and also learn from other rare diseases, other diseases, how do they solve these same problems, because they have the same problems. And get together in these networks that already exist to build solutions. So this is something else. As I said, too many solutions might not solve the problem either. As a joint project, we could build a platform or an app for patients so they can get access to everything else we're building. Maybe starting with a simple map of what we're doing so they can come to us, and maybe starting with something else. In order to really do what patients need, I think across European member states or other countries who participate in ECRA, I think it's important to really understand what patients in these countries need, what are really overlapping needs. So do patient journey surveys and really elaborate what do patients want, not produce something that no one's going to use. And I know Italy is working on one of those patient journey questionnaires or surveys, and other countries might as well. So I propose to just get together, and while we do this, also already asked on implementation of things, what patients want this, and do the very solution-oriented. Investigate legal and other barriers, data sharing barriers maybe, invite industry to participate, and see what's already there, what can we do to combine things, and also apply maybe for some kind of funding. There's some ideas, I'm sure there's better or others. And thank you so much for listening to me, and so welcome for your advice and ideas.
Thank you very much, Helena. It's a very nice presentation. Any suggestions? The back, I see, also in the back. You need another microphone for the back. You can start, you can start.
Okay, just, a splendid talk. And I think many opportunities. One, I tried to convince to, let's say, educate orthopedic surgeons to do a better job. And actually, in 35 years, I didn't succeed. This is the biggest task I think you can have. On the other hand, we started in 25 years ago to train patients with the disease, to educate, let's say, undergraduates, graduates, GPs, podiatricians, how they should have been examined. Yeah? Mm-hmm. And it was a kind of postgraduate course for GPs. They got points of it for that and so on. And it's now standard in all universities in Belgium. Yeah?
That's great.
And actually, we measured what was the effect. The effect is not that you, let's say, increase the knowledge. You completely change the attitudes towards the disease, towards the patients, which is very important, I think. So that's one idea, and it's still working. So we do it already for 25 years now. And another thing at the European level, we trained also patients to participate in recommendations in the trial design. And you don't need many of them, but it's very important. So 2 things you could do, I think.
Amazing, thank you. Very good ideas.
Yeah.
Thank you very much. Helena, when you did the survey, was it an online survey or was it
Yeah.
Just on that note, because as you know that with our group we do a lot of co-production, co-design and a lot of patient engagement, a little bit like what was just suggested with our trial designs. But we became very aware that the people who were engaging with us were of a certain demographic and educational background. And where we're seeing widening health inequalities in many of our countries, actually that's one thing just to be aware of. These, the digital solutions are amazing, but we have to consider low digital literacy, so we're not alienating people who also have the same needs for diagnosis and care and treatment, because certainly work that's been done in other countries in other neuromuscular diseases have shown that across certain communities the diagnosis can be delayed by almost a decade. So it's just that when you're going forward with this, having an eye on that, and that's something we're trying to do with some of the work that we're doing.
Yeah, thank you so much for this comment. I was actually so surprised to see so many people I didn't think that were so digitally affine answer the survey, but I definitely agree with you. I mean, even getting an email and getting the survey to their account, and that's a bias.
Yeah, but I think we don't know the people we haven't reached yet.
For sure, yeah. Good point, thank you.
Other suggestions, ideas, concepts? Yeah, Catherine, here. Yeah, two. Okay.
Just maybe as one prompt, given that we heard from Cleopas about his efforts. Cleopas, do you think there may be a way to connect these efforts and as part of the PhD training curriculum to leverage some of these suggestions as we've heard? Where do you see synergies?
Yeah, I think we can always add, for example, new technologies for assessment and for empowering patients to contribute and hear the patient voice. So we have that already through the patient associations, but I think some of the ideas that Helena presented are very interesting, and I think ECRA is actually a very good platform to materialize some of this, because here you have everybody who needs to work on this. So I think it's a very nice opportunity.
First Catherine and then Mary.
Thank you. I think we also have the strength in your associate members from across the pond. We have an online global clinician directory where people can put in where they're from and find a clinician, and 70 CMT centres of excellence spread around the globe. So, as well as patients as partners in research. So I think in some places, some of the problems that you've highlighted have been solved, but they've not been solved globally. But fortunately, we're very collaborative. So it's exciting that you want to roll this out to more places, and we'd love to help.
Yeah, thank you so much. Just commenting on that, I actually often recommend the CMTA page to patients, but it's the language barrier and everything, other things, so I think it's a very good start. Thank you.
Thanks, Helena. That was very nicely thought through. One suggestion I would say of a fairly immediate deliverable that could be done is one of the things that I've noted in the TTR field when the drugs became available is the health economics is critical for each country to decide whether they will license a drug. So one of the things we've opportunity to do is do that. Now, we've a project we're looking at the moment. There's multiple little projects, but actually I would suggest we make an application to an EMC workshop to try to find across Europe, is there a common way we can measure health economic in a way that will be useful at EMA, MHR, etc. So that would be something that we'd probably do if we got the right people involved with it, with the health economic experts, a small group to do it. It's doable, and it could be, if you like, it could be an ECRA idea to go to the ENMC with. So I would suggest maybe to think about that.
That sounds great. Thank you so much.
I agree. This is a great idea. There is something already ongoing in France, for instance, as presented by Cleopas, and in Italy, thanks to the CMT rate, we will start something similar. So the great idea is to integrate this, because it will be very important for the authorities to know the economic burden for the patient, for ourselves, and there is no data but for those collected in Germany.
Paco? So there will be an NMC workshop.
Perfect, let's do it.
I mean, this is really very relevant. What we are doing now in Spain, we are reevaluating now the national strategy on rare diseases. I'm the scientific coordinator. And one of the points now, we have 6 points. One is the new one, is the health economy, because not only for CMT, obviously, this is rare disease as a whole, but it's really relevant because we really don't know exactly what's happening. And I think we cannot accept that everything we say when we are talking about rare diseases is because the new treatments, the spinal muscular atrophy treatment or the future treatment are going to be so expensive. This is the only comment that we always listen to about that. So we have to discuss, to talk about all this in CMT, in rare disease as a whole. So it's a very good idea to have economy people working with Cleopas. This is the project, and now in this one also.
Definitely. Thank you.
Okay. Mike has one. That's the last question. Last comment, idea, concept, whatever.
Just, I don't know if it's an idea or whatever it is, but...
it's a fishbowl.
Well, in that case, we're fishing for a lot of the, through a lot of the similar issues in the States and with some of our colleagues in Europe. And obviously, we're willing to, share ideas and collaborate. So I hope there will be mechanisms to take advantage of what each of us are learning.
Please. Yeah.
Thank you very much. We will do that.
Thank you for that comment.